start?
Hello, my name is Anna. I'm a cancer survivor. I'm in my 40s. I was a patient in Oasis of Healing since October 2008. And this is my husband, Dan.
I'm Dan. And how we got here was, a friend sent me an email link. We were getting some treatment at the VA, and there were wonderful people at the Hawaii VA, but they were giving Anna conventional chemo, and we saw patients up and down the hallway dying from organ failure because of the treatments. And when they gave her 6 to 9 months to live, we started looking for other options, and we had dabbled in some raw food before. So when we heard Dr. Lodi's message about the low-dose chemo and the raw food, it was perfect for us. So we came to check it out. And when Anna got here, she was in bad shape, fluid in the lungs, remember?
Yes, I was on the wheelchair, and I was wearing oxygen mask 24 hours, and thank God I barely made the flight from Hawaii to Phoenix, 6-hour flight. So, and then that day we came, I had my first treatment, I believe.
Showed up here with fluid in the lungs, we took x-rays, and I think by then we were used to having fluid in the lungs because she'd been drained about 5 or 6 times, but I think people here were a little bit more scared than we were.
Yeah.
Because
yes, it is.
Like, she's gonna be alright, she's gonna be alright. Like, well,
and remember my oxygen level was 86 that day.
Yeah.
And it's really scary.
But it was refreshing to, nowhere else have we ever gone where the doctor, didn't clock out, and he personally stayed here, Dr. Lodi, waited for her to get her x-rays. It was already 6 o'clock, and waited for her to come back from the x-rays, and just made sure everything was in order before he clocked out for the day. That was personal care, one-on-one with a doctor.
And also all the 2 nurses were there, and one of them, Michelle, I remember, and Tracy, probably, Tracy. They stayed so late and prepared some food also for us, and it's really, I feel like I was really being taken good care of, and I just feel like it's like you going back to mom's house and family, and you just not too much worries and fear. Of course, as a cancer patient at that time with stage 4, I got lots of fears, but that day I feel like, oh, I can finally kind of like put my heart in my body and just let the doctor handle the rest.
Well, the important thing was the attitude of hope here is so strong. The minute you walk in the door, we're going to get you better, we're going to conquer this, we're going to take care of this. Whereas every time you leave here to go get something done at a nearby hospital, a scan or something else, the minute you walk in the door, they keep telling you, well, I'm going to level with you, this isn't going to get better. The statistics say, I just want you to be prepared. You need to know the truth. I don't want to, give you false hope.
Right,
so,
and the doctor even told me in the emergency room, said, you may stop breathing tonight. And just in front of me, I was like, no, doctor, I don't agree with you. I'm not going to stop breathing tonight. And I'm going home tomorrow morning. Do whatever you need to do for me, please.
So, a word of advice is, when you leave here and you go to a hospital for some kind of treatment you can't get here, you've got to shut your ears, go get your treatment done, and come back. Don't get sucked into the negativity and the leveling with you.
And also, you always, have hope in you, because people can only influence you by giving you some good news or something, but hope is born from your heart. So just remember, when you have hope, you have hope. And people can't give you that. You have to have that on your own. And you insist on what you're hoping and do everything you need to reach that, go in your heart. So really, it's important. Let's say this, if you think you're going to live, you will.
And it's great to support each other here. The patients are supporting each other here. When Anna was having rough days, there was one really bad day where she wanted to give up because it was just tough in the beginning, fluid in the lungs, and it took a while to turn it around. But once it turned around, everything changed. But about the week before it turned around, she was really frustrated. Almost every patient and almost all the nurses, one by one, came and visited with her and encouraged her, hang in there, we're going to turn this around. We've seen so many cases like yours come in here and turn around, cases where people were given up on, they all had death sentences, they were all mangled and in horrible shape from the treatments they'd gone through prior to coming here, and they were able to turn it around, and that gave her the encouragement she needed.